Thank you very much. Yeah, this evening I'll be presenting effectiveness and safety of hydroxyurea in the treatment of sickle cell anemia children in Jos, Nigeria. As I've been rightly introduced, I'm Dr. Ofakunrin from the Jos University Teaching Hospital. This study that I'm presenting was supported by the Fogarty International Center of the National Institute of Health and has been presented in the Journal of Tropical Pediatrics. Well, this is a map of Nigeria showing where Jos is located, very close to Abuja. Then this is the picture of the Jos University Teaching Hospital. Sickle cell anemia, as we all know, is a chronic and progressively debilitating condition that is characterized by ongoing hemolytic anemia, recurrent acute painful vaso-occlusive events, and so many other complications, which are majorly organ dysfunction, which begins very early in life and worsen over time, with the sufferers having poor quality of life. As it has been stated that hydroxyurea was discovered long time ago, and several studies have documented that hydroxyurea is capable of modifying these pathogenesis that I've mentioned, the hemolytic process, the vaso-occlusive event. And the hydroxyurea is capable of reducing the clinical manifestations and the complications of sickle cell anemia. Despite all these positive developments, we discover, as Professor Agumadu and other speakers have rightly put that the usage of hydroxyurea is low among sickle cell disease patients in Nigeria because of apprehension that is related to effectiveness and safety of the medication. So on account of these, we decided to evaluate the effectiveness and safety of hydroxyurea in children with sickle cell anemia using a prospective study, which was a quasi-experimental study that we studied 54 sickle cell anemia children between the ages of 4 and 17 years who had severe manifestation, moderate to severe manifestation of the disease. So what we did was to get some clinical parameters in the previous 12 months before commencing hydroxyurea. And these clinical parameters are the parameters that can be verified easily. The number of vaso-occlusive crises requiring parenteral analgesia. You discover that if they have this, they have to come to the hospital or they have to have injection, in which case they can easily remember that. Acute chest syndrome, the number of blood transfusions and hospitalizations that they had in the previous 12 months before we commenced hydroxyurea for another 12 months. In the same vein, we got some hematological parameters, obtaining the fetal hemoglobin, white blood cell count level, the packed cell volume, the platelet count, before starting at the onset of the study, before starting the hydroxyurea, and we compared these after 12 months of hydroxyurea. In between these, we still do full blood count to make sure that we monitor for toxicity according to the guideline of National Institute of Health that was released in 2014, the expert panel. And as a way of monitoring the safety of hydroxyurea, the participants were also monitored monthly for adverse events, both clinical adverse events and hematological adverse events using the full blood count and the other hematological parameters that we measured. We started the dosage of our hydroxyurea for this study at 20 milligram per kg, and we increased by 5 milligram per kg after every 8 weeks until we used escalated doses until a maximum dose of 35 milligram per kg or a maximum tolerated dose, which was described as a dosage 5 milligram per kg below the level at which toxicity was discovered. And the toxicity, there were predefined values for the toxicity. I won't go into the detail of that because of time. So, but in this study, I want to mention that we never also exceeded 1 gram. So it's either 35 milligram per kg or 1 gram, anyone that was higher. So among the 54 children, 30 were males and 24 females. and the mean age of the participants was 8.5 years, and the mean maximum dosage of hydroxyurea that we used in this study was 29.7 milligram per kg. About 94% of the participants had good medication adherence. They were really taking the medication. Now, this is a table showing the clinical parameters of the patient before 12 months before hydroxyurea and 12 months after commencing hydroxyurea. We found out that the proportion of our participants that had more than 2 episodes of vaso-occlusive crisis in the 12 months preceding the commencement of the therapy reduced, that had more than 2, reduced from 50% to 3.7%. In the same manner, those that had more than 1 episode of transfusion before hydroxyurea was commenced, the number of the episode of transfusion reduced, the proportion reduced from 17.7 to 1.9%. We also had significant reduction in the number of hospitalizations. And also, more importantly, those few ones that were admitted, we found that the duration of stay on admission when they were on hydroxyurea reduced significantly compared to when they were not on hydroxyurea in the previous 12 months. Likewise, the number of patients with acute chest syndrome reduced from 6 to 0. That was what we found in the clinical parameters that we're looking out for. Then also our hematological parameters, we discovered that there was an increase in the hematocrit level, the packed cell volume, with a median value of 2%, which was significant. And likewise, the white blood cell count and the platelet count, as it was as had been reported by the previous speaker, reduced. And we all know that this is a good development because elevated steady state of these cells, the white blood cells and the platelets, they've been documented to be known trigger for vaso-occlusive events in this patient. In addition to that, the fetal hemoglobin level increased from a mean value of 7.8 to 14%. It almost doubled. As we know that the main mechanism of hydroxyurea effect is in the induction of fetal hemoglobin in addition to some other things. Now, concerning the safety of our patients that we monitored monthly or as the need arises, we use clinical parameters that they reported and that we examined for, and also the hematological events that we got from our hematological testing. It will surprise us to note, and it is actually a good development and what we warmly receive, that about a quarter of our patients reported increased appetite and increased energy. So for instance, a child that looks sickly, not very active in school, in class or at home, the parents reported that, they eat well now and they play a lot, which was a very, very good development. We felt that this may be related to the increase in the hematocrit level, but this may be a good study for us to have a good design that we should be able to look at the main mechanism behind these positive developments. Then we also had the few of the patients that they had gastrointestinal manifestations. The comprising abdominal pain, diarrhea, vomiting, in which case it's just very few of them. And this started almost immediately when they started the medication and resolved before 1 week into the medication without any separate intervention. One of our study participants had hyperpigmentation of the skin, palm, and the nails. This has actually been documented in the literature as one of those side effects that it can have, and it doesn't affect the quality of life at all. We also discovered that one of our patients had passage of red urine, in which case we were not able to determine the causality of this manifestation and the intake of hydroxyurea because the red urine cleared almost immediately before we could investigate further. Regarding the hematological events that we noticed, especially the myelosuppression, which is a recognized side effect of hydroxyurea, which has also been a beneficial one, is only 6 of our patients that had leukopenia. And the leukopenia in this patient were dose dependent in which case some that started with low white blood cell count level, the dosage, the level of their white blood cell count dropped. And what we did was to stop the hydroxyurea for a week and reduce the dosage by 5 milligrams per kg below the dosage at which toxicity was noticed. And the white blood cell count normalized. Likewise, the thrombocytopenia. I want to mention at this junction that none of these patients developed any infection as a result of the leukopenia, which was well transient, and none had bleeding tendency episode. Then again, these side effects were those that developed the side effect of leukopenia and thrombocytopenia did that at a dosage between 25 to 35 milligrams per kg. None of our patients had the myelosuppression with dosage that was 25 milligrams per kg and below. So this corroborates the fact that the clamor for the fixed low dosage, that having a dosage of 25 milligrams per kg may be a event that we can actually look at, and we're suggesting that we can actually also have some patients that will be on different dosages, low fixed dosages of different level, so that we'll be able to have a more robust scientific basis for this. None of our patients had severe anemia, unlike in baby ox study, or in which case 1% of the participants had severe anemia. In conclusion, I want to state that our study found that hydroxyurea is effective in reducing the frequency of painful vaso-occlusive crisis, acute chest syndrome, blood transfusions, hospitalizations, and the duration of hospitalization among Nigerian children with sickle cell anemia. And we want to state too that hydroxyurea is quite safe. Although we followed the patient for this study for 1 year, but the patient population that we have now, we have like 7 years experience so far. We initially started at the anecdotal level, but now on a large scale. And on account of the findings from this study, the management of the hospital, in conjunction with the youth pediatrics department, decided to adopt hydroxyurea as standard of care for our patients using the available guideline. As I speak to you presently, we have over 350 patients, 350 children that are on hydroxyurea, and they are doing pretty well. And there's also a concept that we've noticed among our patients, in which case we termed that as patients-driven advocacy. As a parent, once a child was placed on hydroxyurea and the child was doing very well as what we've witnessed, then they tend to tell other parents, and they tend to come to the clinic to even request that they want their wards to be on hydroxyurea. So this is a positive development that we can also explore to reduce the barriers to the intake of hydroxyurea. I want to state that there are also barriers, as Professor Agumadu has actually put succinctly. We are also working on this. Finally, if there's an intervention that can significantly decrease morbidity, prolong life, and improve the function and health-related quality of life of our patients, it would be good to offer such interventions to them. And hydroxyurea is one of those. Thank you very much. These are my references.